Monsieur Dubé, you mentioned for your telephone helpline to find services that if it's not crucial, perhaps for something like seeing a family doctor, that could be organized within 2 weeks. It doesn't have to be within 36 hours. I know from personal experience, fortunately, I have a family doctor, and I booked an appointment, but he's so overwhelmed that he can't see me for 3.5 months. So how will you find room in the system if they're already that booked up, that people who don't even have a family doctor can call this number and get an appointment in 2 weeks, for instance?
That's good. This is the reason that we have this hub. In French, we call it the l'orchestrateur, is the information. And again, I want to reassure the doctors, because I don't want to go on a fight for this, but we need some information as to on general statistic and not individual statistics of the doctor. When we have now the opportunity to look at one JMF, okay, when they are connected and they have made their number of appointments available. Sometimes in Rimouski, it varies between 2 and 5%. So this is not much that we're asking in exchange of the gap. But what we're asking the doctors is to say, for your JMF, are you answering those people, because we can see those statistics, are you answering them in, I don't know, 80% of the time in 36 hours, 30% of the time? And if you don't, is it because you don't have the number of the right doctor, the number of nurses, you see? So having the information, not on an individual basis, but on a global basis, allow us to monitor that. And that's what we have to do. And I think that we've seen in Rimouski and Rivière-du-Loup that those stats are so important that they can manage and they can discuss with the doctor, say, maybe with you we need 1% more, because sometimes a doctor that will see, I'll say, 100 patients in a week, to ask him to see 2 or 3 patients more in a week is not very much, but that can make a big difference on the people that day will need the doctor. So, but we need to have the data on the number of hours, of weeks that an appointment, not 3.5 months as it is for you. I'm sure you have a good doctor and he's doing his best, but I think we need to have that information.